This final segment will review the contents of the pelvis that make their way out through each of those exits to the lower limb. The last activity is to review the contents of the pelvis and which opening that they lead through to make their way into the lower limb. Before we do that, let's briefly review those openings. We had the opening that's deep to the inguinal ligament and led from false pelvis into anterior thigh. The opening through the obturator canal that led from the true pelvis down into the medial thigh. And then if we turn the pelvis posteriorly, we can see that we had the greater sciatic foramen that led from the true pelvis out to the gluteal region, and the lesser sciatic foramen that led from the perineum out to the gluteal region. We've just been reviewing the openings from the pelvis to the lower limb, and over the course of the last few video segments you've looked at most of the contents of those openings. What we're going to be doing on this table is trying to summarise which structures pass through which openings either to or from the pelvis. To start this exercise, I've made it a little easier by blanking out some of the squares. So in other words, for some of these openings there are no nerves, vessels or muscles that are of relevance to the lower limb passing through that opening. I've also given you one example of a completed square. So the femoral artery and vein and the accompanying lymphatics make their way through the opening that's deep to the inguinal ligament, and therefore from the false pelvis to the anterior thigh. What I'd like you to do is to complete the rest of this table, and you can pause the video now to do so. Hopefully you're able to complete all of this table correctly, but let's briefly run through your answers. So the femoral nerve accompanied the femoral neurovascular bundle with the artery and the vein, and also the lateral cutaneous nerve of the thigh comes out more laterally in that space, in that opening underneath the inguinal ligament. Additionally, we had the iliopsoas muscles, and these muscles therefore will lie anterior to the hip joint and so were powerful flexors of the hip joint. The obturator canal, not surprisingly, contains the obturator artery and vein with the accompanying lymphatics, and in the same neurovascular bundle we have the obturator nerve. And so these structures are making their way from the pelvis down into the medial compartment of the thigh that they supply. The greater sciatic foramen contained the gluteal vessels, superior and inferior gluteal vessels, and the accompanying lymphatic bundles. And it contains a number of nerves all derived from the sacral plexus: the sciatic, the superior and inferior gluteal, the posterior cutaneous nerve of the thigh, and a couple of smaller branches that innervate some of the muscles of the gluteal region, the nerve to obturator internus and the nerve to quadratus femoris. This opening also contains a muscle, the piriformis, that originated inside the pelvis from the anterior surface of the sacrum and made its way horizontally out through that opening out to the femur, and therefore is a powerful lateral rotator of the hip joint. The lesser sciatic foramen does contain some nerves and vessels, but they're not relevant to the lower limb, but it does also contain another one of those muscles that's a lateral rotator of the hip joint, the obturator internus.